Hello and welcome to The Mint. I'm Cecilia Kamputa and we're joining you live from our Z10 studios in Harare, Zimbabwe. Now ahead on our show, Zimbabwe's pharmaceutical sector is navigating a high-stakes crossroads as the country faces an alarming rise in counterfeit drugs and a growing number of uncertified pharmacists operating in both urban and rural pharmacies. In a sector where quality and trust are critical, fake medications from antibiotics to blood pressure tablets are increasingly infiltrating the supply chain. Health authorities warn that these fakes contribute to drug resistance, treatment failure, and in some cases, patient fatalities. This public health threat comes as the Pharmaceutical Wholesalers Association gears up for its annual joint conference scheduled for July 5, 2025 here in Harare. The event is expected to tackle pressing challenges including regulatory reform, access to certified pharmaceutical services, and technological innovation in drug distribution and tracking. Mr. Patrick Munamba, the director of Yopat Healthcare and the chairperson for Community Pharmacists Association, is one of the key voices expected at the conferences. He is going to join me on the show to share insights on the sector. Now, don't go anywhere. The Mint will be right back. Welcome back to The Mint. I'm Cecilia Kamputa. We're coming to you live from our Z10 studios in Harare, Zimbabwe. Now, the pharmaceutical industry observers say the urgency to reform the sector has never been greater. Zimbabwe healthcare system depends not only on access to medicine, but ensuring that what's being dispensed is safe, effective, and prescribed by qualified professionals. As new technologies like blockchain traceabilities, digital prescriptions, and mobile pharmacy platforms gain traction, the sector is also being reshaped by evolving patient needs from chronic disease management to telehealth-based consultations. With growing calls for policy reform and digital transformation, the July 5 conference may set the tone for the next phase of pharmaceutical regulation and innovation in Zimbabwe. Now, I'm joined in the studio by Mr. Patrick Munamba, the director of Yopat Healthcare, to take a look at the pharmaceutical industry in Zimbabwe. So welcome to the show and thank you for joining us today.
Thank you very much. It's a pleasure.
All right. So to begin, let us look at the pharmaceutical industry landscape in Zimbabwe. Why are certified pharmaceutical professionals crucial to Zimbabwe's health delivery system?
So being certified, it means that there is a process that you undergo before you venture in either in the value chain of the medicine. So we cannot talk of quality or efficacious or effective if you don't deal with the provider, someone who is behind. So the quality starts from the person. The quality starts from your training. So it's very critical that if we want to achieve quality of medicine, we need quality people, because we have got people who will be involved in those processes. So having a certified person, it means there is a process that you've undergone, you've gone for school, you've done your degree, and you are certified. There are boards which are responsible to make sure that you are now qualified. Just finishing your degree doesn't mean that you are a pharmacist. You might finish your degree, but you're not a pharmacist. But you need to be registered, you need to be certified. There are boards. There is a board, the Pharmacist Council of Zimbabwe, which is responsible to see that you are qualified to handle medicines.
All right. Speaking of pharmacists needing to be certified, there have been other incidences in media reports where some maybe pharmacies had to be closed down because some of the people were operating without proper certification. Can you speak to that?
Yeah, well, because what happens is that at times the definitions will differ from one sector to another and from one population to another. If the public saw something with medicines, they are seeing a pharmacy. But in the eyes of a regulator, a pharmacy needs to have all the licenses, including the pharmacist responsible for that operation. So at times those cases where either that registered pharmacy was found without the supervision of a pharmacist. And otherwise, just to give a highlight, for a pharmacist to operate, the pharmacist should be there continuously. So it's very critical if you get to a pharmacist. It's your right to ask that I want to see a pharmacist.
Okay.
And they will show you a pharmacist. And then right now, our regulators has gone further to say every pharmacist during practice, you must be wearing your badge like this, so that you'll be easily identified. If you see someone wearing this, it means that that one is the pharmacist in charge.
All right. And still looking at the pharmaceutical industry landscape in Zimbabwe, can you speak to what you deem the biggest barriers to equitable pharmaceutical access in Zimbabwe today? So
today, you realize that we've got many challenges, which some we've got control, some we don't have. But you find the barrier to effective access. One major thing is the economy that we have. You realize that like being sick, you cannot really plan to be sick. It's something that can come. But the problem that we have in our country is that the majority of people, they use the out-of-pocket to fund their health care. The majority, if not more than 90%, they are not on any medical aid. So it means the financial burden will cripple the access. Another thing, you look on the weak supply systems.
Okay.
Why do I say weak supply systems? Right now in our country, more than 88% of our medicines, we import them. Which means if we import, we cannot reliably say, no, tomorrow you will get this. There are other factors that can take place. So you cannot base on someone's market. Imagine we are getting this medicine from another country. They've got an outbreak there. Do you think they will be able to ship while their country is dying? No. So because we have got a limited number of manufacturing industries and we are relying mostly on imported medicine, it's a challenge, which means you may want the medicine, well prescribed, pharmacist there, anyone there, but the product not there because it's not there in the market. Another thing that we can look for, which is similar, is just similar to the supply chain, is that limit or limited number of manufacturing companies. That becomes a burden. And then the last not least is the issue of knowledge, education. You know, Zimbabwe is proud to have about 99% literacy rate. But there are things, some of the things that we do that you cannot say we are literate, because we don't appreciate much.
Okay.
To differentiate, because you might have the product but not of good quality because of the source that you are getting it. So people, they need to be educated on what is really a pharmacy is or a health center is.
All right. And when we look at the availability of medicine in the urban pharmacies and the rural communities, how are you as a pharmaceutical practitioner working to bridge the gap that is there between these two distinct areas?
Yeah, thank you very much. You know, as a Community Pharmacist Association, we realized that our president is always talking about leaving no one behind, no place behind. So right now, I can safely say there is a movement in the number of pharmacies in the rural areas to make sure that our parents there back home, they can access. So some of the things that we've done, like right now, we've managed to engage our regulators, saying, look, we know that the rural community, they don't have the same muscle as the urban community. So can you give us like better rates to our licenses, like discounted rates? Some of our regulators already, they're already doing that, like the Medicine Control Authority. If you open a pharmacy in a rural area, it's cheaper than opening in town. Okay. If you go to Pharmacist Council, if you're opening in town, it's expensive than opening in the rural. They're just trying to promote. So as an association, we already engaged other stakeholders, like our Health Professions Authority, saying, no, look, let us try to promote by having better charges out there so that it will be complementing the people that we are going to meet there.
All right. You also talked about how some people are not very knowledgeable when it comes to the sector and what constitutes a pharmacy or a health center. Are there strategies that you're putting into place to ensure that people have access to safe medications that are also affordable to all Zimbabweans, considering that a bigger chunk of the population is using cash out of the pocket to sustain their health needs?
Okay, thank you. So as the association, we have got lined up programs that we are doing to make sure that people, they are conscientized, they are given information to know what to expect when you get to a pharmacy. For example, we have been visiting like secondary schools, we have been visiting with like even the career guidance days, trying to educate the public what to expect. Because the source determines the output, the outcome. Where are you getting your medicine? So we are trying to have this as an awareness every year. We have got some days for actually a week, that what we call Pharmacy Week, whereby we'll be trying to conscientize the public about how can you ensure that the medicine that we are receiving is safe. It's being safe, it starts from the practitioner.
Okay.
Because if you are certified, you know all the guidelines that governs the profession.
All right, and then looking at how there are so many chronic diseases, old ones and new ones that are coming up now, and then also looking at how some of the donor funding that was coming into maybe sub-Saharan Africa, including Zimbabwe, has been cut off. What role are community pharmacies playing in chronic disease management and also health education in general?
Yeah, thank you very much, Cecilia, for that. Maybe to start with, let me highlight that community pharmacy is the nearest healthcare service provider to a person. You know, right now you may see that even the opening times, they are a bit flexible. So it means they are now closer to the people, unlike in the yesteryears. So our role now is to make sure that we monitor what we call therapeutic medicine monitoring. What do I mean? I'm saying you are on a hypertensive medicine. You have been prescribed by the doctor, but you have been given 3 months. It doesn't mean the disease will not progress because you have been given 3 months. Many things can happen, maybe due to the medication, or maybe due to your own lifestyle. So as community pharmacists, we are now saying every month that you are taking your medicine, even between the month, when you come to the pharmacy, we have like basic tests that we do, like checking your BP, blood pressure, checking your glucose, just to see the progress. What is really happening to your medicine?
Okay.
Yes, we are taking them more religiously, but what is it? So that's one of the roles that we are doing to make sure that our patients, the public, they are well monitored. You know, 1 month is long. You might be taking it religiously, but things can change. So if we don't monitor that, it means you before you know it, you say, no, this person has been affected by the same disease or by the same medication.
All right. So moving on to one of the issues that have been very topical, issue of the availability of counterfeit drugs and uncertified dispensers. Can you speak on how these are threatening the national health outcomes for Zimbabwe?
So these counterfeit medicines, it's only that we don't have any other word that we can use. Because we are saying they are counterfeit medicines. But in actual fact, they don't qualify to be medicine. So they are threatening the health of the people. Remember, if you go and take your medicine, you're thinking, you will be saying, no, I must be healed. But actually, you think you are taking this medication, but it's just a label. There's nothing there.
Okay.
That thing is affecting our population because we've got people relaxing it, well relaxed at home, thinking that they're taking BP medications. While they're not BP medications, they are just labels. They are just the colors, but there's nothing there. So that becomes critical on where are you getting your medications.
Okay.
Actually, we cannot expect optimum therapeutic outcome if we don't know where you are getting your medicine and who is supplying your medicine. We cannot rely on what is coming out from that treatment.
Does your sector have any effective measures of detecting and eliminating these counterfeit drugs from circulation?
Right. So our association, actually that is the duty of the Medicines Control Authority, because this was that became topical. So right now, the Medicines Control Authority of Zimbabwe, they've developed a system whereby they can just come to your pharmacy, what we call GS1. They can come to your pharmacy. All medicines are just the same. But that machine, they will detect that is this the real medicine or is a fake. So you can have them in the same basket, but they are now using the machine to detect that. Because remember, a fake medicine becomes fake if it doesn't carry what it's supposed to have. But from the eyes of a public, it's just the same.
Okay.
In terms of color, shape, our public knows medicines by color and shape. But that technology that they are now using can detect that no, this is not the real medicine.
All right. Now, time for us to take a breather. After the break, I continue with my conversation looking at the pharmaceutical industry in Zimbabwe. Don't go anywhere. The Mint will be right back.
Didn't graduate. I guess I blew it.
You couldn't advise him anything. He would just look at you and say, so who do you think you are?
We were just like really spoiled.
And then they just give me the receipt and I'd pay.
The guy walks in one day and then he says that he wants to make a movie.
He was blowing the money.
There was just like this habit that he had where as soon as he got money, it was gone.
I just didn't have the skills or the experience.
This money, I could see it disappear so fast.
Welcome back to The Mint. I'm Cecilia Kamputa and we're joining you live from Etienne Studios in Harare, Zimbabwe. Now I'm still joined in the studio by Mr. Patrick Munamba, the Director of Yopat Healthcare, as we take a look at the pharmaceutical industry in Zimbabwe. So, sir, to continue with our conversation, are there any technologies or systems that your industry or any board within the industry is using or considering for supply chain verification?
Yeah, thank you very much. Right now, because of the muscle that we are receiving from the suppliers of fake medicine, it prompts us as the industry to think outside the box. So right now, we are in the process of working on the issue of barcode system.
Okay.
Because now there's no one that you can trust. So the barcode system will help us to identify exactly the medicine that you are getting. So it will be easier because all the medicine that we get in this country, they will be registered through our Medicines Control Authority. So it means if our barcode system can be integrated, if I scan this, it will show that this medicine was registered by Medicines Control Authority or not. So it will be easier to detect that what you are receiving is not registered.
Okay, so outside of the technological systems that you can use, what policies would you recommend to strengthen the pharmaceutical regulation in Zimbabwe?
Right now, my recommendations, we need to look. It's obvious if we're talking about or even all those counterfeits, we can agree that there is somewhere these medicines are coming from. They are not even raining from the sky. So it's a time that we should strengthen our borders as much as possible to make sure that they are watertight, so that we cannot wake up even those counterfeit medicine.
And how can the Medical Control Authority of Zimbabwe also and the Ministry of Health better collaborate with private players to curb this malpractice?
Thank you very much. So you find the Ministry of Health and Medicine Control Authority, they work hand in hand. At times you realize that there are some moments where they can even do like the joint operations. You can see that there was a time whereby there was a directive to remove like Johnson powder from the shops, both from the farmers and the supermarkets. It was not just the MCC, it was a collaboration. Actually, I still remember the notice was released from the Ministry of Health. So there is a close collaboration where they work together to make sure that our public, they are receiving what is deemed to be the most safe and efficacious medicines.
All right, and looking at how our environment is changing nowadays digitally, how are digital tools such as e-prescriptions and mobile apps transforming the pharmaceutical service delivery in Zimbabwe?
Yes, thank you very much. You know, you cannot run away from technology, but we are actually the beneficiaries of this technology. The e-prescription right now, they are likely to be the game changers. You find that in the past, people, they just knew that the ratings, they are not eligible. And that's another thing that can lead up to wrong medication. But because of this advent of e-prescription, you cannot say I cannot read an e-prescription.
Yeah.
What about the delivery time? Right now, the doctor can prescribe the exact medication a kilometer away. You can receive it. It's no longer like we need to be in the same place or the patient need to be there to be in the same place. So it's just actually changing the delivery time and the accuracy. You know, no one is perfect. You may misread the prescription. You are trained to read the prescription, but you can misread the prescription.
Yeah.
But this e-prescription is now good for us, and they are convenient. They can be accessed at any time.
And your organization, do you have any specific technological innovations that you've adopted recently?
Right now, besides the plan of the barcoding system, already, like in the farmers, actually we adopted the technology, I think, earlier ahead of others.
Okay.
Our regulators actually recommends that you must have at least like the computers that can store, that you can process. They are no longer recommending you to have like the manual work of doing the job. So it's rarely that you can go to a pharmacy and you still see they are still using the manual system. We've got the systems that are there, which we pay, so that you can even trace your inventory, you can correctly capture the details of your patient in the right time, in the right format, unlike in the past where you use like the files.
All right, and looking at also times changing, how are patient needs in Zimbabwe shifting, particularly with the rise of non-communicable diseases?
Now, because of this globalization, there are many changes that are happening. You see that some of the diseases that we are now seeing today were not there in the past. Historically, we are aware that the diseases like even the hypertension, they were associated with a certain age and certain events. But right now, because of the lifestyles that we're now living, there are now even new diseases like the hypertension. Because of all this environment, people are now suffering from this, like the industrial smokes that are coming. So there are some diseases that are coming because of the changes that are actually happening.
And what support systems do you think are needed in Zimbabwe to align pharmaceutical services with modern healthcare expectations?
So the modern healthcare expectation, when you say previously, like the changes in even the test of the patient has now changed. In the past, we were aware that if you need a service, you need to go maybe 5 kilometers or 10 kilometers. But besides being busy or whatsoever, you just feel you cannot just walk 5 kilometers to access service. So it's like the business has shifted. But they've shifted from the patient is seeking the service, but it's now coming closer to the patient, because that's what the people now need. So what is critical now, we are happy that even the issue of internet is improving in our country. You know, if we talk of technology, we cannot talk of technology leaving out the internet. Right now, there are many players, some coming, some are expanding, to make sure that almost everywhere there is a coverage. So that at the end, we will see go in the rural areas, accessing the e-prescription from a mobile app, and then trying to consult the pharmacist. Pharmacist, today I couldn't sleep, I'm feeling like this. Or down there in the rural areas, in a field, speaking or communicating with the doctor, communicating with the pharmacist, what best can I do? So we just recommend that our government should continue engaging more players in the internet industry, because you find that's the backbone of technology.
All right, so you're gearing up for your annual joint conference scheduled for July 5 here in Harare. Can you share with us briefly what the event is about and the anticipated outcome briefly, because we are running out of time?
Okay, thank you very much. So we've got a conference on the 5th of July, this Saturday. So we are working with the theme fostering access to pharmaceutical services. We are inviting different sectors. We've invited our Honorable Minister of Health, as well as the Honorable Minister of Industry and Commerce, to make sure that we face this big elephant in the house together. That cannot be done by Ministry of Health alone. It cannot be done by private sector alone. But we need a systems approach of doing, to make sure that every sector is involved in the value chain, is involved in making sure that people can access this medicine. We are expecting to have different speakers that will be talking about the changes that are happening in the globe. We are now living in a global village. We cannot remain of yesteryear. We've lined up speakers that will be talking of different subjects with regard to our conference.
All right, Mr. Patrick Munamba, thank you very much for joining us today on The Mint.
Thank you very much. It's a pleasure.
Now, that is all we had for you in today's episode of The Mint. I'm Cecilia Kamputa. Good afternoon and pleasant viewing.